Welcome to our training videos on the new digital anaesthesia perioperative pathway. In the following videos, I'm going to demonstrate how to navigate the system ready for our go live. Let's crack on. In this video, I'm going to demonstrate how to perform a digital pre-anaesthesia assessment. So how to do this: you have your patient that you want to perform your assessment on. You come over to the left hand side and you can see there's a few new tabs that we've added to PowerChart. So what you want to do is you want to click on the anaesthetist, and that will take you through to your pre-anaesthesia workflow. Okay, so this is a lot of categories which are contained on the current blue charts, which have just been coded for and created here. Okay, what you want to do is go through all these categories in order, and what this is doing, this is called an M page, and basically this is pulling lots of information from different parts of the patient record. For example, it's pulling through blood results, it's pulling through past medical conditions, it's pulling through most recent observations. So obviously it'll only pull through three things if they've been added into the system, so it's as good as the system itself. But it's very useful, and it brings a lot of information to your fingertips at a click of a button. So what you want to do is you want to move through these different categories and fill the different boxes in. So any patient information will pull through straight away. Patient operations. So let's say we're having a lap appendix. You have to free type the procedure. Baseline observations. Can you see it's already started to pull through the most recent observations for the patient? NC-pod classification. So what I've created is some auto text for all these different free text boxes. So if you see the title of the box, if you put a full stop and then type the title, so NC-pod, and I want you to click enter, it'll bring up an auto text function. So it basically it's easier for you to document certain aspects. Click on the down button here, and you can click it was urgent. Next stage, past medical history. Can you see it's already started to pull through past medical history, what's already been coded? If anything's been missed off, what you do is you go onto here and you add a problem. So say she's also hypertensive. So type in hypertension, you click on it, and it will add it onto your list. Okay, so this is useful because it actually adds it onto the list, so it's coded so the hospital can charge, and also it'll update her EPR records as well. Any previous procedures for the patient will pull through. Any family and social history or pregnancy will also pull through. And it's taken a lot of this information from the preoperative assessment which has been performed, if it has been performed. Any previous anaesthesia records using the new SA Anaesthesia app will pull through into here, so she's not had any at the moment. ASA grade 1. Allergies will pull through, so no known drug allergies. And then we go on to medication, so it will list all her regular medication. So regular medication is medication that the patient takes at home, which has been added on at pre-assessment, and that will pull through here. If the patient is an inpatient currently on the ward, the medication will pull through here. And then a medication timeline tells you exactly when that dose has been administered. It's a bit like the drug chart summary. Any relevant investigations will pull through into here. So these are the blood results. She hasn't got any on this test patient, so that's why they're not pulling through. So it's important to note that unfortunately ECGs and group and saves will not pull through onto here because they're separate systems. So you'll have to look at ECG separate, and you'll have to look at ICE still for your group and save status. Moving down, we've got blood components. So again, free text. So if you put a dot and type in blood components, so it's the first one on the list, Click here, some auto text which you can fill in to help you document information quickly and accurately. Group and save required. Yes. Has she got 2 valid group and save samples on ice? Yes. The blood components available in the transfusion lab if required? Yes. Cross-match blood requested? No. Also put in an aspect about atypical antibodies because that is quite common here at Bradford. Next stage we'll move on to airway review, and as you can see you are unable to add anything currently within this airway review, and that's because I've created specific power forms which will feed into this, and I'll demonstrate it at the end of the document, at the end of the tabs. Metabolic equivalent, exercise tolerance, again a power form which will feed into this category. Any relevant documents associated with this patient's journey we'll pull in through here. Fasting status, again type your dot and type in fasting. So you've got fasting status reflux. And we've got fasting status for clear liquids, sip till send. Fasting status for food, fasted, greater than 6 hours. Reflux status, no history of reflux. And then we move on to our anaesthetic risks and benefits discussion. Okay, so this is where we talk about what we're going to do with the patient. And again, you can free type, but I've also created auto text to help you document the discussions that you have with the patient. Now, auto text is a really powerful tool because it allows you to document lots of information quickly. But it comes with a warning because true consent is obviously individualised to the patient, but just because you've documented something and not discussed it with the patient, that is not a true consent. So just be careful with using the auto text. But I've created auto text for risk and benefits discussion for general anaesthesia, neural axial techniques, regional blocks, sedation, and then for procedures including arterial line, central venous catheter, awake fibre optic intubations, and also gastric tubes. So there's auto text for each individual thing. So we'll talk about general anaesthesia here. So dot general anaesthesia. Okay. So this brings up our risk and benefits discussion with the patient. General anaesthesia, she's undergoing a rapid intravenous induction, and she's going to have a rapid sequence induction with cricoid pressure. The benefits are to provide a state of controlled unconsciousness during the procedure, and I've split the risks of general anaesthesia into very common, common, uncommon, rare, very rare. This is taken from the Royal College of Anaesthetists, and you can either, once you've had a chat with the patient and discuss all these risks, for the very common risks, you can either say all discussed, so all these will be discussed, again common or discussed, or you can go through each individual risk and say that you've discussed it. Okay, or all discussed, and then you've discussed all these different aspects. Put some information about overall risk, post-operative pain management, and also post-operative destination. Okay. So now we move at the bottom to these power forms. So if you remember, if I scroll back up to the top, we have our airway review and our metabolic equivalent or exercise tolerance power forms. So these can be found at the bottom, so power forms. I've also got other ones on here, like the surgical outcomes risk tool, Lee's revised cardiac risk index, but you can see the airway assessment and the anaesthetic functional assessment. So to complete an airway assessment, you click on this, and it gives you, and you can quickly type in a click which apply to the patient. And once you've completed this form, it will feed into that airway category. and I'll demonstrate it through when we move on to the next page. So you won't see it here, it will pull through onto the next page. Let's also complete an anaesthetic functional assessment, so greater than 4 mets. If you don't fill it in, it won't pull through, so don't get too concerned. So this is our first draft of our anaesthetic assessment, okay? Once you've completed everything that you want to do, what you're going to do is move on to our second draft of the anaesthetic assessment. Now, before you move on to this second draft, there's certain things which are really important that you do need to fill in. For example, any past medical history that you want coding to pull through, you need to complete on this draft. Any allergies, you need to complete on this draft, okay? Let's click our pre-anaesthesia assessment. It's pulling it through to this second draft, which you can have a look at before you finalise the case. So it's pulling through all the information that we've just completed. So all the patient details, lap appendix that we typed, end-sleep classification, etc., histories, ASA grade. You go to airway assessment. Now this is what's pulled through from the pre-assessment, okay? And also as well from our assessment. Then the pre-assessment will not pull through eventually. Metabolic equivalents that we've just completed, baseline observations, fasting status. And this is our risks and benefits discussion with the patient. So let's have a look down at the bottom. Okay. These again, if you've not filled them in, will not pull through. So if you're happy with that, you sign and submit. And you're going to create a pre-anaesthesia assessment note. You're going to sign it. So once that's signed, it's securely stored in the documents, pre-anaesthesia. And that's your anaesthetic assessment there. This does pull through into this. The airway assessment, functional assessment, does pull through into this. It's just it will pull through onto into the final form. You want to go back in and edit it? No problem. Double click it. You want to revise your note. Say things have changed. You can go in and revise it and resave it. So that is a very quick run through of how to conduct a digital pre-anaesthesia assessment.